Dr. Steve here from Notting Hill Family Wellness Center. Treatment for a hip flexor or a psoas injury at our clinic usually starts with IFC machines. So the IFC is an electric stim. We hook it up in certain locations. I'm just going to put this part right in here and run that with a heat pack on you for about 8 to 10 minutes. It helps loosens the muscles up and gets a lot of blood flow. After that, I'll go into a thing called Shockwave. Shockwave is a pneumatic gun. There's a bullet in the tube here that smacks the end of this, and it beats up a ton of scar tissue. We use a little bit of ultrasound gel on the patient. Come in, very basic, and we'll work this in here. It feels like it's really hitting deep in most patients when we get the psoas. We'll move it up, all the way up, sometimes the lower part of the abdomen, and work the whole area like that. We usually hit the patient about 1,200 times with that, and then progress on to the next treatment mechanism. So ART on a hip is kind of the worst things we do at the clinic here. So essentially we're going to find the tight muscle, which in this case is your psoas. I'm going to get my thumb nice and deep in there, and then I'm going to bring you up and then back down all the way. Some patients can't even put their leg off the table without me putting pressures. Again, our patient here has no problems at all. We'll do probably about 30 seconds or anywhere from like 8 to 10 passes at this. Most patients will want me to stop well before that. Finally, if it's a very, very severe injury, we're going to do a instrument-assisted soft tissue or grafting on the area. There's different tools we use. This one here, we call it the handlebar. I'm going to come in and just basically scrape the muscle nice and deep in here to loosen stuff up. So this will go a bunch of passes with that too, and it will help loosen everything up. Patients will go home with some icing instructions and some hip flexor stretches. Treatment's usually between 8 and 12 visits. People will get a lot better. A lot of times we do have to adjust the low back too, just because where the psoas attaches, and we'll show that in the next video. So treatment for the psoas or hip flexor, IFC and heat to start, then we go into Shockwave, then we do some ART, then we scrape it down with the graft and ice when the patient gets home.